Could you unmute yourself, sir?
नमस्कारम् अस्माकं सर्वेभ्यं मम विनयपूर्व गुड मॉर्निंग सुप्रभातं धन्यवादः उषा श्रीनिवासन जी for taking me in this. Thank you.
Thank you very much, Ji, for joining us.
Presentation slide
So video can I switch off?
You can even share if you have the PPT. We can just test that also.
This is Mac, my dear.
Okay, what is it?
അത് സൂമിൽ എങ്ങനെയാണ് നീ നോക്കുക എനിക്കറിയാം
അല്ല ഷെയർ ചെയ്യാനല്ലേ
share.
ഓക്കെ
Make here.
ഓക്കെ 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 സർ പി പി ടി ഓപ്പൺ ചെയ്യണം സർ ഫസ്റ്റ് ഓപ്പൺ ആണോ സർ ഓക്കെ ഇതല്ലേ ഇതല്ലേ സർ
ഇതല്ല ചെറുതാക്കുന്ന ഡെസ്ക്ടോപ്പ് എങ്ങനെ പോകുന്നത്
മിനിമൈസ്
ടേക്കാണ് അതുകൊണ്ടാണ് ഞാൻ
It's just so much
Can you see, madam?
Yeah, it is starting, sir. Your screen sharing is starting, sir. It is yet to come.
Now?
No, sir. It is yet to come, sir. Could anybody else see the presentation of? Yes, it has come, sir.
Yes, it is visible.
It is visible now, sir.
Yes, ma'am. We're all able to see. I mean the screen, the home screen.
So it is your desktop screen, sir.
Okay. Desktop. Now?
Yes, sir. It has come. Yes. Yes, sir. It has come, sir.
It's okay, sir. അവർക്ക് ഓട്ടോമാറ്റിക് നമുക്ക് സ്ക്രീൻ വരും
എനിക്ക് വായിക്കണ്ടേ നമുക്ക് ഇത് പോവണ്ടേ
Niyati ji has also joined us. Hearty welcome to you, madam.
slideshow down sir
Dr. Niyati is with us. Thank you very much, ma'am, for being with us.
ఇవరు పోండి
ఓకే ఇది మినిట్
లేదా ఇది Can you see my screen?
Yes, sir.
It is visible, sir. Yes.
Yes, sir. Yes, sir.
So if you can say me, I can start. When to start, you please let me know, huh?
Yes. Can we begin, ma'am? Anusha?
Yes, I'm the one who is going to coordinate.
Okay.
Yes,
just
sir.
okay.
Today it's Lata ma'am who's going to come here. Ma'am, we will start with the prayer, ma'am.
Yeah. Can I just start? Can I just have a small prayer?
Yes, I will.
Okay.
Ajnana timirandhasya jnananjana shalakaya चक्षुरुन्मीलितं येन तस्मै श्री गुरवे नमः. गुरवे सर्वलोकानां विषजे भवरोगिणां निधये सर्वविद्यानां श्री दक्षिणामूर्तये नमः. Am I audible and visible?
Yes, yes, ma.
Ma'am, you are audible
Yes,
and
now you
visible,
can
ma'am.
proceed. Proceed.
Namasabhaye. In connection with the 11th Foundation Day celebration of Global Sanskrit Forum, we are here today on the third day of the three-day international conference on yoga and Ayurveda, the foundational pillars of Indian lifestyle. We all have joined through virtual mode for the technical session 6, in which we have Professor Dr. P. Chandramoulishwaran with us to explore on the topic Abhyantara Snehapana and Insight. Professor Dr. P. Chandramoulishwaran is a distinguished Ayurveda physician, academician, researcher, author, and institutional leader with over 2 decades of dedicated service in the field of Ayurveda. He currently serves as the principal cum head of the Department of Panchakarma and the medical superintendent at Ayurveda College and Hospital, Coimbatore, one of the premier institutions for Ayurvedic education and healthcare in India. An eminent scholar in Panchakarma, Dr. P. Chandramoulishwaran completed his BA-MS from Shri Jayendra Saraswati Ayurveda College, Chennai, securing a silver medal, followed by an MD in Panchakarma and a PhD in Kaya Chikitsa. His academic and clinical expertise spans Panchakarma therapies, parasurgical Ayurvedical procedures such as Ksharakarma and Agnikarma, integrative Ayurveda, and evidence based clinical practice. With extensive national and international exposure, he has delivered seminars, workshops, and clinical training programs across several countries, including France, Germany, United Arab Emirates, Turkey, Singapore, Sri Lanka, Hungary, Lebanon, and Spain, thereby contributing significantly to the global promotion of Ayurveda. He has successfully treated more than 18,000 patients worldwide, particularly in the management of chronic and lifestyle disorders through personalized Panchakarma interventions. As an academic administrator, Dr. P. Chandramoulishwaran has played a pivotal role in institutional development by securing prestigious recognitions, including the Best Institution Award in the year 2025 from the Tamil Nadu Dr. MGR Medical University and National Accreditation Board for Education and Training, Quality Council of India, from which obtained accreditation for the institution. He is also actively engaged in research, curriculum development, PhD evaluation, and professional bodies related to Ayurveda education and healthcare. A prolific author and speaker, he has published research articles and that runs through pages, authored scholarly books, and served as a resource person in numerous national and international conferences, continuing medical education programs and workshops. His professional vision is centered on advancing Ayurveda through clinical excellence, scientific validation, and global outreach, while ethically grounded future practitioners. Professor Dr. Chandramoulishwaran, we all are very eager to listen to you. Without any further delay, over to you, sir. The session is yours. Thank you so much.
Thank you, madam. Thank you for your introduction. So basically, today I would like to, initially when Usha madam spoke, I didn't know the target audience and other thing. So she told me to talk any topic. So initially I said that I will go with that concept of Abhyantara Snehapana, but later I realized when I saw the other speakers and people those who are going to attend this more than the some of our students are attending now, I think. So other audience are like general and common audience. So that topic would be more in depth, and if people don't know the basics bit of Ayurveda, may not understand that particular topic of Abhyandar Snehapana. So with the permission of the chair and you, I would like to present about Panchakarma in preventive health. Okay, because I saw it's everything related to prevention and yoga, and it is I saw all other the theme of the workshop also. So accordingly, I have chosen a topic, and in the last minute I could able to make some PowerPoints. So I'm going to present the topic on Panchakarma in preventive health, and nobody was doing this topic. So since I am a Panchakarma specialist, I thought this topic will be opt. So hence I am presenting this topic. Is that okay with you, Madam Hall? Is that okay with you, everyone?
Sure, sir. Sure, sir.
Yes,
Very
sir.
good.
Please
Yes.
proceed, sir. Yes, sir.
Thank you. So basically, many of you might be knowing about Ayurveda. So basically, if you see, the treatment, is classified into Shodhana and Shamana. One is pacification of doshas, and other one is elimination of doshas. Okay, this is how you treat the person who is suffering from various ailments. Okay, the Shamana therapy, where you give internal medicines like herbs, gudikas, churnas, okay, arishtams, asavas, all oils, all those kind of pacification medicine, treatment. Whereas Shodhana, or eliminating the doshas from the body, you administer Panchakarma. Okay, because always the Shamana therapy alone, the oil application or internal medicine alone will not help to cure the disease, especially the chronic diseases. So it would be all those medication, all those Shamana therapy would be good if the disease is very simple in nature, if it is not chronic, and not number of doshas are involved, or not number of dhatus are involved. Then with simple Shamana therapy, by administering internal medications, you can get rid of the disease, you can take care of the disease. But whereas basically, if the disease is chronic in nature, if it is deep seated, and if more than one dosha is involved, more dhatus are involved, then you have to do Panchakarma only. Okay, so Panchakarma, not only, if you see the main idea of Ayurveda itself, Swastasya Swasthya Rakshanam, Aturasya Roga Nivaranam. So first itself they say Swastasya Swasthya Rakshanam only is the first aim. Then only Aturasya Roga Nivarana comes. Okay, so this gives a clear idea how they were very logical, and how they were fantastic in their thought process, just by saying that prevention is better than the cure. Later only these people coined this term, prevention is better than the cure. Whereas our acharyas, our acharyas and the people, those who are doing the rishis and everyone, those who invented Ayurveda, and those who are taking care of the people at this time, all the Vaidyas and all those people understood that preventive concept. Okay, prevention is the first step for everything. Then only the curative aspects comes. That's why they said about Dinacharya. Somebody I saw, they are going to talk about Dinacharya also, and Ruticharya, Sadvrta. So these three things are very, very important: Rasayana and Vajikarna. Okay, so these five things. So Dinacharya, Ruticharya, okay, then Sadvrtam, okay, then comes the Vegadaranam, Navegadaranam, and Rasayana, okay, some extent Vajikarna. So see, these six things comes under preventive aspects, because if a person want to live long, he must do all these things in order to prevent number of diseases. Okay, so they gave very important ideas, or they gave importance to the preventive aspect of the disease. Okay, so in that, if you go through it, the Dinacharya Adhyaya and the Ruticharya Adhyaya, they have explained about Panchakarmas and allied Panchakarmas. Okay, like Abhyanga, Udvartana, all those, I call it as allied Panchakarmas, because they help in helping, to conduct the Shodhana therapy or Panchakarma therapy in a very good manner. So allied Panchakarmas, they have explained in Dinacharya Adhyaya, whereas the real Panchakarmas, they have explained in Ruticharya Adhyaya. So according to the Rutu, everyone must undergo some kind of elimination process process, some kind of Shodhana process, some kind of Panchakarma process, so that they prevent the doshas, aggravating further, so that they can live healthily. So mainly this preventive aspect of Panchakarma comes in Swastavrita, that is mainly comes under Dinacharya and Rutucharya Adhyaya, this Panchakarma and allied Panchakarmas, both you see in Dinacharya and Rutucharya Adhyaya. Okay, so you can see how beautifully they have told about this preventive aspect in the Sadvrita, or in the preventive chapters itself. So that shows the importance of prevention, than the cure. So Panchakarma or Shodhana therapies, Pancha Shodhanas or Panchakarmas, 5 elimination therapies are always not only meant for curing the disease, but always meant for preventing the disease. Okay, so Panchakarma is basically both preventive as well as curative. So here we will see the preventive aspects of Panchakarma and how they help in prevention of various diseases. Okay, so and one more thing, basically this Vata Pitta Kapha is responsible for all our good health and bad health, our life, or long life or short life, everything depends on this Vata Pitta Kapha only, and the equilibrium of this Vata Pitta Kapha is good health, and in equilibrium of this Vata Pitta Kapha is ill health. Okay, so basically this Panchakarmas or Rutu Shodhana, or this preventive allied Panchakarmas in Dinacharya helps to balance this Vata Pitta Kapha. Okay, they make them in the natural state. Okay, so that the person doesn't develop diseases. Okay, so this is in nutshell. So and one more thing, if you see, these all the Panchakarmas cannot be given to everyone, so it depends on the Prakriti, depends on the predominance of which dosha is involved. We can go either one Panchakarma or two or three, and some of the allied Panchakarmas. Okay. So basically, if you see these Vatas, I know this is a basic introduction about the Vata. So Vata is mainly the important, quality of Vata is movement. So without movement, nothing happens. So movement, that is air and space, is very, very important, because without movement, it cannot take, nothing can be propelled inside the tissues or inside the cells. Even Pitta and Kapha need the help of Vata to circulate. So movement is the very important factor in Vata dosha. So this Vata dosha, the movement, that is Chalaguna of Vata, helps all the nutrients and the waste products to enter into the cells and come out of the cells. So Vata does that important kriya of movement. Okay, so including energy movement, cellular movement, all the movements, all the intracellular mechanism, extracellular mechanism, calcium, transportation, potassium transportation, all those things are done by Vata. Okay, and along with the Vata, then Pitta involves in the energy protection, and Kapha helps to disintegrate energy into the energy production into the other places. So Vata Pitta Kapha 3 together helps in the formation of cells. By that, formation of dhatus happens. Okay, so digestion, metabolism, energy production, movements, everything depends on the Vata Pitta Kapha. Okay, all right. So about this Prakriti. All right, so everyone is made out of Vata Pitta Kapha, and though one or other doshas will be predominant. If Vata is predominant in this person, then he is Vata Prakriti, then Pitta is predominant. So like that, and you have Dvandaja Prakriti, and you have all the together, like Vata Pitta Kapha together, Sama Prakriti person. Okay, which is very rare to see. So most of the people are Dvandaja Prakriti people, and around 98% of people, and maybe 1 or 2% of single Prakriti people will be there, and Sama Prakriti people are always good in health. They will live long without any problem. So it is very difficult to see such people. Okay, so depends on the Prakriti, depends on the because Prakriti plays a very important role in choosing the Panchakarma therapies, especially the preventive. Okay, all right. Then now you see nowadays I have taken this about this lifestyle disorders, because nowadays you see most of the diseases, lifestyle disorders are increasing day by day. It is increasing, and you nowadays you see, like, young people are dying out of heart attack, myocardial infarction, or heart, you would have seen that obesity is increasing day by day. Polycystic ovarian disease, now they made as PMOS. They have changed the term also. Many of the people, I don't know whether they know, so recently they have changed the PCOS into PMOS. They have changed the nomenclature, because they have involved now hormones and metabolism and everything. So because of the poor lifestyle, and if you see around people, most of the schools, colleges, the younger people, younger generation, you see nowadays the obesity has become very common problem, and the insulin resistance has become very common problem. Polycystic ovaries has become common problem. Infertility has become common problem. Okay, and all these things, in male infertility is also increasing, and because people are not doing enough exercise, they are taking too much of carbs, sedentary lifestyles, all those things are increasing. So people are suffering from n number of diseases, lifestyle diseases. It can be psychosomatic, it can be insulin resistant, it can be diabetes mellitus, it can be anything comes under lifestyle disease, like thyroid disease. All those stuffs are happening because lack of exercise, lack of then too much of stress, too much of eating. So all these things are happening in and around the world, and India is going to be the capital of cardiac disease, as well as it is going to be the capital of the diabetic mellitus in another 10 years. So the lifestyle diseases are very, very increasing, and the non-communicable diseases. Okay, so subset of the lifestyle disease are nothing but the subset of non-communicable disease. Though it is not communicable, but it is becoming. Obesity is, they have released a statement that it is a pandemic now. Obesity is a pandemic. Okay, it is happening. So because of this lifestyle changes, and too much of nutrients are available, and people are not doing even the normal simple household works, the younger generation, so they are suffering. So in this scenario, okay, the Panchakarma helps to take care of lots of lifestyle diseases. Okay, even in our hospital you would be seeing that people losing weight, or the uncontrolled diabetes are bringing down, we're bringing down, all those things are happening. Okay, that is because the lifestyle diseases are increasing. That's where the preventive aspect of Panchakarma plays a very important role, because when everybody does this kind of Panchakarma, at least Panchashodhana once in a while, once a year, like that, they can prevent all those lifestyle diseases. Because here when we do the Panchakarma therapies, we not only help them to eliminate the vitiated doshas, but always we help them to regularize their metabolism, so they feel good physically and mentally. Okay, so you can see this is going to improve a lot. It is going to be a headache. Okay, so we have to play a very important Panchakarma, especially Ayurvedic persons are going to play a very important role, especially the Shodhana therapies. Okay, so basically Panchakarma detoxification helps to remove Agnidushti, Kafadushti. Okay, and this Manoha Srotas clarity and Medoha Dushti, all those things, it helps, so that it helps in preventing or curing the lifestyle disorders. So basically by actions of Agnidushti, removing the Agnidushti, Kafadushti, and clarification of mind and Meda Dushti, Panchakarma is going to help in treating so many lifestyle diseases. Okay. So basically, if you see, the other commonly occurring lifestyle diseases includes depression, joint pain, fatigue, arthritis, metabolic disease, because these are all, they are all interrelated. Okay, obesity alone can cause these kind of things, and too much of blood sugar level can cause the fatigue. Obesity can cause arthritis, joint pain. Okay, all those things. Okay, then early degenerative changes, metabolic changes, immunological changes, everything they have noticed in the people, those who suffer from these kind of lifestyle disorders. Okay, early aging, you can see, that's why Ayurveda clearly state about Rasayana. Before Rasayana, you do to do Panchakarma. So early aging is happening. That's the reason why you see people look older even in younger age because of the obesity, polycystic ovaries, and other hormonal imbalances in the female and males also. You can see, liver load increases. Nowadays you see this non-alcoholic fatty liver disease. That's also the nomenclature they have changed. Okay, I forgot the name of it. So non-alcoholic fatty liver diseases, excessive cholesterol, all those things are happening in younger people. Okay, that's because of because of this lifestyle changes only. All right. Then you can see can be traced back, indigestion, nutritional problem, lack of calmness and focus, constant feeling of agitation, okay, and restlessness or jitteriness, okay. All those things are happening to them because of this lifestyle, sedentary lifestyles, okay. Then sedentary lifestyles, workaholic professional life, okay, inadequacy of physical exercise and leisure time. Okay, dilemma with the lifestyle disorders are these are insidious in onset, takes longer span to become cause of death. Medicines are not effective in this treatment. These disorders are not easy to manage, and there is no permanent cure for such kind of disorders. Until and then discipline is taken care of. Until and then dinacharya. That's why you can say vyayama comes under dinacharya. Okay, sleeps comes under dinacharya. Right? Udvartana comes under dinacharya. Abhyanga comes under dinacharya. So you can see vyayama, though it comes under dinacharya, many people don't even do vyayama. Okay, then definitely all the lifestyle disorders we are going to suffer. Okay, so dinacharya and rutushodhana is very, very important. People are not following that. In the olden days, that is the reason why they told about the fasting in the name of God. At least in the name of God, if you say people do fasting, so nobody does fasting. You don't give rest to your stomach, non-stop eating and always sitting, watching mobiles or sleeping too much. No exercise, zero exercise. So the dinacharya and rutucharya is not at all followed properly. And sadvrta, good thought process, good thinking, helping others, okay, and all those things, sadvrta, according to me, along with the dinacharya and rutucharya, sadvrta plays a very important role. Ayurveda, is a beautiful science where it alone talks about sadvrta. Which science talks about sadvrta, you tell me? Modern medicine, did he tell you that you need to be good, you need to be good with others, you need to be kind, you need to be helpful, all those things, which makes our mind very clear and nice. No other science talks about it, because sadvrta is important to make you a good person, right? When a person is good, when he makes a good society. When the society is good, he makes a good, good in a country. When the country is good, it makes other country good. So sadvrta is very, very important. Just like that, even the first year teachers, I don't know how importance they are giving to this sadvrta in shaping of the future of the children. First year teachers are very, very important when they admit the students. Ayurveda is very completely, it is not only scientific, but it is also something to do with the divinity and other thing. Okay, atheist also can study, it is not, but sadvrta is where it is nothing to do with the religion or anything. It just tells how to be a better person, you, and how you can make others' lives better. Okay, very, very important, but many of us don't follow that. Dinacharya, especially the sadvrta. Now Vegadharana Adhyayam, he told about the Vegadharana. We don't think that, what is this concept? Trust me, it's very, very important concepts. Okay, those are very, very, Vegadharana Adhyayam is very important. So, these in the first year, whomever is listening, the teacher should give emphasis on these adhyayas, which helps to shape up the students' physical as well as mental health and their life. Okay, it's very, very important. Many of us, just like that, we teach so many things. We don't give emphasis on these chapters, because it shapes up the students' life, physical and mental life. Okay, it makes them a better person, better practitioner, better vaidyas. Okay, so very, very important. So basically, all these diseases, okay, the lifestyle diseases explained in Ayurveda comes under Santarpana Janya Vyadis, where the person is like aristocrat, he don't want to do anything, just enjoy his life, eat, sleep and do nothing. Okay, so basically when the person does this, Santarpana Janyavadis are very easy to create, and they are life threatening, and they create some of the sub diseases which are very very bad and difficult to treat. Okay, so basically all the doshas are involved. As I said, without water nothing can be happen. So in the Santarpana Janya, though all the doshas are involved, the Kapha Dushta, okay, and Agni Dushti and Meda Dushti, okay, and Ama formation are the very important factors in creating these lifestyle diseases. Okay. Okay, then you can see basically. So pathogenesis occurring due to this Western lifestyle, that is sedentary lifestyle, okay, can be prevented by following Panchakarma therapies. Okay, so if somebody want to prevent these diseases, or if they want to treat these diseases, Panchakarma is the main thing, along with some Shamana therapies also. So basically Sadhvarta must be followed, Navagadarnya must be followed, Dinacharya must be followed. Fantastic, very important. As I told, Vyayama is a Dinacharya. Nobody does that. Alright, Dinacharya must be followed. Okay, along with that, if they do the Rudushodhana, or anytime when you can come and do the Panchakarma or Shodhana therapies, all these diseases can be preventable. Okay, so like Nasya, Abhyanga, okay, Mardana, Gandusha, all those things, Udvartana, it comes under Dinacharya, must be followed in order to have a good life and in order to prevent the Santarpana Janya Vyadhis. Okay, otherwise the prevention is impossible. Okay, so basically these are all importance to improve the metabolism. So because these are all called as metabolical and immunological disorders. So when you do this Panchakarma, okay, you prevent this metabolical as well as the immunological diseases. Okay, Ayurveda hypothesizes that metabolism of the body is an indication of physiological state of Agni at the different level in the body. Okay, any disturbances or defection in the metabolism leads to choking of channels. Okay, Srota Dushti happens. Alright, so biological pathogenetic factor are named AMA. So basically what happens due to sedentary lifestyle, due to excessive eating, due to non-doing Dinacharya, due to Vegadharana, okay, not following the Sadvrita, not following the preventive Panchakarma, your Agni Dushti happens, Sroto Dushti happens, Sroto Avarodha happens, which leads to AMA. AMA leads to creation of lots of diseases, as I told, all the lifestyle diseases and immunological diseases. So, and this Panchakarma breaks this pattern. The Srota Dushti is removed, Ama is removed, okay, Kapha Dushti is removed, Meda Dushti is removed. So the pathway is cleared, then the person becomes normal in a very simplistic manner. This is how it is done. Okay. So basically, why Santarpana happens? Because Madhura Ahara, okay, fatty Ahara, Adhyashana, sedentary lifestyle, all these things, these are the Nidana, okay. So basically, because of this Nidana, Ama is formed, okay, it moves to different parts of the body and disease occurs, So basically, I told about Panchakarma, the introduction. So this is important. Failure of contemporary medicine in prevention of major health burdens forces us to revert back to the original of detoxifying naturally. So you don't have this idea, prevention is not there much in, of course you have vaccines and other things that you can call prevention, but they have all other their own set of problem also. So modern medicine fails in these aspects. Okay, so failure of contemporary medicine in the prevention of major health burden force us to revert back to the original detoxification naturally. This is where Panchakarma excels. Okay, so where the modern medicine fails, where they don't have the answer, we have the answer in the name of Panchakarma. Okay, so Panchakarma is an effective therapy in managing autoimmune, neurological, psychiatric and musculoskeletal disease of chronic and metabolic origin. Okay, here where the Panchakarma helps. So we do Panchakarma, to prevent all these issues so that a person can have good life. Okay, so in the current scenario, these unique procedures are widely practiced by physicians in India, many other countries globally for prophylactic and therapeutic purpose. Okay, prophylactic and therapeutic purpose. That's why it is gaining momentum, it is gaining importance. Thanks to our Indian government, they are taking very good initiatives, okay, to propagate the science of Ayurveda. Okay, and recently you might be knowing when Ursula von der Leyen came, the European president, they have signed a deal that in the Europe we are going to start Ayurvedic therapies. The future is very bright, so it is up to the students to grab it. Okay, so Panchakarma therapies is considered superior to Shamana therapy. I told why, because Shamana, whenever you do the Shamana therapy, na tesham punarudbhoha. When you do Shodhana therapy or Panchakarma therapy, the disease never reoccur, and Shodhana therapy has its own kind of limitations, because it cannot help in chronic disease. It can only prevent in acute disease, or only up to certain extent it can help, whereas Panchakarma or Panchashodhanas helps in preventive as well as curative disease, and it can the spectrum of disease can be cured by Panchakarma is wide. Okay, so basically what it does when you do the Panchakarma, okay, Panchakarma accomplishes the removal of toxin accumulated and return the doshas to normalcy and balance. All the Panchakarma regimes are followed to achieve the homeostasis and not just counter the specific symptom. You can see it is not only symptomatic, it brings homeostasis of the body. Very, very important. That's what Panchakarma really does. It is not only symptomatic. Okay, so it brings all the equilibriums. Dosha dhatu equilibrium it does. Mala dosha dhatu mala equilibrium it does. Okay, it's a very important. Okay, so basically all the Panchakarma regimes are followed to achieve the homeostasis and not just counter the specific symptom. That is why the outscores the conventional medicines when it comes to tackle multidimensional disorders like lifestyle diseases. So this is very important. This is why it outscores the conventional medicine when it comes to tackle a multidimensional disorders like lifestyle disease. So this is beautifully said, and this we must do it. Okay. So Panchakarma constitutes 5 different procedures. All of you know there are some Shodhana procedures. So absolute Shodhanas are Vamana and Virechana, where you throw the excessive vitiated doshas from through mouth or by through anus. Okay, then through nose. So it can be preventive, it can be curative. Okay, so basically it can be Vamana and Virechana are the absolute or the Shodhanas. That's the reason why you don't know, whereas Shamana Nasya is there, right? You have Shamanavasti is there, you have Anvasanavasti is there, you don't have Shamana Vamana or Shamana Virechana. That's why they are called as absolute Shodhana. They alone can act as Shodhanas, excellent Shodhanas, the Shodhanas, whereas other things can be Shodhana or Shamana. Okay, so when it comes to the absolute Shodhanas, where you want to get the excellent result by Shodhana, only you must go for Vamana and Virechana. All other therapies, when you compare to Vamana Virechana, are compromises only. They will not do much Shodhanas like Vamana and Virechana, because they are called as absolute Shodhanas. Okay, so it depends on each and every doshas, depends on specific doshas. The Panchakarmas are done, or the allied Panchakarmas are done. Okay, so Panchakarma plays a vital role in prevention, maintenance, conservation of health, promotion of longevity. Okay, all those things. So Panchakarma is done before Rasayana, before Vajikarna. So it is not only prevents the health, it helps the person to live long and in a youthful form. Okay, live long in a youthful form. So it is very good for prevention as well as cure the diseases. Okay, I told you about about the preventive aspects and all the initial stages itself. So basically Vamana, Virechana, Vasti, Nasya and Rakta Mokshana. Okay, Vasti is 2 types. One is Anuvasana, that is with oil enema. One is decoction. Okay, so Vamana is where Kapha dosha is removed, or Kapha Anubandha dosha is removed, where the doshas are eliminated through the mouth. It is like inducing vomiting. So it is usually given in obesity, thyroid, diabetes, okay, asthma, polycystic, PMOS, polycystic metabolic disease they call now, okay, etc. Then Virechana, where you give some medicines, the person go to toilet so many times, like induced diarrhea. Okay, so skin diseases, hyper acidity, number of diseases we give this Virechana. Okay, these are all very limited. I have put. There are so many indications are available. Everybody knows that. Then Vasti, it is two types. One is oil enema, one is oil or ghee, or is given as a Vasti. Other one is compared with decoction. Okay, decoction mixed with other ingredients is given. Okay, that is two types. One is oil enema, one is decoction enema. Okay, decoction is pradhanya, so there is two types. Then you have nasya, where the nasal medicines are applied through the nose and doshas are eliminated through the nose. And you have bloodletting, where the vitiated blood or the bloods the vitiated or the bad blood is removed by putting jaloka or prachana or needling, or even by phlebotomy or by venesection. Okay, so basically not every patient needs all the therapies. Okay, depends on the condition of the patient, depends on the emotional condition, physical condition. Either one or two therapies are done along with the allied panchakarma. Okay, and the length of stay and everything. So physician decides what treatment, what panchakarma is necessary for him. Okay, what allied panchakarma is necessary for him. Okay, and with the karmas also can be done, agni karmas also can be done. All depends on the patient. Okay, basically this is where it is importance of panchakarma, where you see the importance or the first panchakarma, or where preventive aspect comes as a panchakarma. This sloka, doshaha katachit kupyanti. Okay, this sloka very very important. This sloka shows about the importance of Shojana. This is in Charaka Samhita. So this is where the root of Panchakarma, or the root of preventive Panchakarma you see in this particular sloka. Okay. So basically what it does, biological system to return homeostasis, and it rejuvenate rapidly the body, also facilitate the desired pharmacotherapeutic effects of medicine administered thereafter. Okay, so Panchakarma has a full therapy role as a promotive, preventive and curative procedures. Okay, so this is also I told you about. Okay, so basically Panchakarmas are done, Purva Karma, Pradhana Karma and Paschat Karma. So always it is like how you conduct the surgery. So you have to do the pre-operative procedure, then you have to do the operative procedure, then you have to do the post-operative procedure. So in the main important is the Purva Karma, where the pre-operative procedure helps the body to prepare to accept the Panchakarma. So then you do the operative procedure where the Panchakarmas, then the post-operative procedures are done to bring the body physically and mentally into the equilibrium, because after the Panchakarma definitely body goes for the toss, the equilibrium is mismatched. So the post therapies are done so that the person comes to now equilibrium both physically and mentally. So Purva Karmas prepares the body to accept the Panchakarmas, and Paschat Karmas brings the equilibrium of the body after the Panchakarma. The dosha and dasus goes for the toss, so that all these therapies, all Purva Karma and Paschat Karma is very very important, not only the Pradhana Karma. Okay. So basically Purva Karmas are 3 in number: Pachana, Snehana and Svedana. Okay, so Pachana to increase the Agni, because you will be giving Snehapana, that is medicated ghee or oil is given to bring the doshas, okay, to soften the doshas, okay, which is there in the shaka. Okay, so if you want to give that Snehapana, either ghee or oil, you need a very excellent Agni to digest, because they are pure fat. Our body is not accustomed to taking of that much fat. So definitely the Agni should be very very excellent. So we give the Pachana treatment where Ama is removed, where Agni is improved, so that the given Snehapana for 3 days or 5 days or 7 days is digested well. Okay, so very important. That's the reason why Pachana therapy is given. Then followed by Pachana therapy, the Snehana therapy, that is administration of oil or ghee is given, so that the doshas which are there in the shakas are softened. Once they are softened in 3 days or 5 days or 7 days, then you give Svedana therapy, because this Svedana therapy liquefy the softened doshas which are there in the shakas. Okay, so once the liquefaction happens, the softened doshas by Svedana karma are liquefied, and they are brought into the stomach and intestines. So once they are in the stomach and intestines, either to vamana or vomiting, or either to virechana or purgation, either they are thrown out of the body through mouth or anus. This is why the purva karmas are very important. Okay, so the pradhana karma involves mainly either vamana or virechana. These are, because this purva karma snehana and swedana you do before doing vamana or virechana. That's why I said as they are absolute shodhanas. You don't do this before shodhana vasti or shodhana nasya. Of course, external therapies of oil application and swedana karma is done, not internally. Okay, so basically that is the reason why these are called absolute shodhanas. Okay, so basically after this, once vamana and virechana is done, paschat karma is followed, that is payadi karma, in order to improve the agni, because after shodhana karma agni will be very weak, the body will be very weak. Suddenly if you give spicy food and other things, you will understand. If you do fasting for a week, and if you are in a sattvic food without much spices, you see immediately you take any kind of food, it will throw up. You until and then you do that, you will not understand, because it happens with me many times. When I go to the foreign country, when I come back, I cannot take these spices, because there the food is very blunt and other thing. So after that only I understood that when you are doing the fasting and when you are doing this panchakarma, how important to be on the sattvic diet, then only the body can be accustomed. So that is the reason why the payadi karma is told, where the spices are reduced. Very simple diet is given, because that helps our agni to improve the health and metabolism. The metabolic process will be smooth. Okay, so paschat karma also very important. You know the importance of paschat karma. Okay, so this is the slide which shows about the purva karma and pradhana karma and paschat karma. Everyone knows about it. Okay, so basically what is health, why importance of health, and why WHO is emphasis on the health. So health is not basically physical. Here health, I say, it is basically physical as well as mental. Very important, because physical health is depends on the mental health, and mental health is depends upon the physical health. Both should be go hand in hand. So one must have very good physical health as well as mental health to have a beautiful life. Okay, so basically you see, this is very important. 31% of adults and 80% of adolescent do not meet the recommended levels of physical activity. This is a recent report. You see where we are heading. That is the reason now NCISM also told the physical activity, we do it in second Saturday and fourth Saturday every time. Please, some kind of physical activity one must do. The children are not at all doing nowadays. And I see lots of obesity in the school going children, in the college. Okay, so very important, because WHO is seeing this is becoming a pandemic. Okay, so the global target set to reduce level of physical inactivity in adults and adolescents is 10%, and relatively by 2025 still it is not happening. In 2030 by 15%. So WHO is trying, that's what they are doing, like marathon, these, that, everywhere they are doing it. So it's our duty to do that. Okay, and these are all the different PubMeds and everywhere, like how the sedentary life increased and how it is causing troubles. These are all some of the thing I took it from the Google in order to understand that how they are creating the metabolic diseases. Okay, you can see once again all these therapies. Okay, and Shirodhara, all those things. Okay, these are all things. So what happens when you do the intervention of Panchakarma, improvement in strength, improvement in flexibility, improvement in mental attention and concentration, improving immune system, injury prevention, detoxification, okay, obesity prevention, and metabolic diseases and immunological, I told, metabolic diseases are all prevented. Okay, when you do the proper panchakarma, this is what is happening to you. This is what will happen to you in a nutshell. This is what is going to be achieved when you do the panchakarma. Okay, so how it is done, we'll see little by little. So improvement in the strength. Okay, so basically when you do the panchakarma, improvement in the strength happens. How the strength may be defined as the application of force against the resistance by voluntary action of the muscles. So sedentary people as well as the athlete will need an optimal level of strength to work efficiently depending on the nature of his activity and occupation. Very important. So it can be improved by doing regular exercise or appropriate physical activity. But strength can also be improved by the Basti Karma of Panchakarma, especially with Niruga Basti and Astabhana Basti. When you do, definitely you are going to impart the strength to the person, not only by exercise, not only by athleticism, but when you do this Basti, you are going to improve the strength of the person. Okay, because Basti, which eliminate vitiated doshas from the body and increase the strength of the body because of its potency is called Nirugavasti. Okay, so it stabilizes the ayu, stabilizes the normal functions of dosha dhatu and mala, so it improves the strength of the person. And also Astapana Vasti promotes happiness, strength, Agni, intelligence. You all know this, how it works. So not only by exercise, when you do this basti, it can going to improve, it will improve the strength of the person. Okay, then improvement in the flexibility. So because these are all needed to get rid of the sedentary lifestyle and get rid of the energy back. So this is what I'm trying to explain here. So improvement in flexibility. Flexibility can be defined as the range of motion of joint. In sport, flexibility can be mainly improved by various stretching techniques, but flexibility can also be improved by use of Svedana Karma. Okay, basically of the Svedana Karma of Panchakarma. Okay, Svedana Karma falls under the category of Puro Karma. Okay, Svedana is defined as the process by which the sweat or perspiration is produced in the body by using various methods. Okay, so flexibility is attained by Svedana Karma. Okay, so basically if you see the definition also, Svedana is the procedure which relieves stiffness, heaviness, coldness and pain of the body and produces sweating. Okay, with the administration of proper sudation therapy, the body becomes soft and attains elasticity. You see here, so elasticity is flexibility. Okay, as a result, it helps in the bending of the body without any difficulty for performing various activities. So of course various activities also very important mildly, but when you combine this sudation therapy with various activities, it helps your muscle to detoxify and it helps your joint to work properly, so your flexibility improves. It's very fantastic. Okay, so these are the different methods: Bhasva Svedam, Nadi Svedam, Upanaha Svedam, Patrapotli Svedam, all those things you know. So by various methods you can improve the flexibility. Okay, and you see this Avagaha Svedam, Patraponda I have explained, so you know all those things, I'm just skipping it. Then improve in mental health and attention and concentration. Okay, mental attention and concentration can be improved with the help of Shirodhara modality of Panchakarma. So Shirodhara, Shirovasti, Shiropichu, all those things you have, not only Shirodhara, Shirovasti, Shiropichu, Shiro Abhyanga, all those things you have. So in order to on the Talam you have application of the medicated paste, application of medicated oil, retaining the medicated oil, continuously pouring the related medicated oil on the forehead, concentrating on the third eye will improve your mental function. So one must do this in order to achieve the mental peace and mental stability. Okay, so it can be done by oil, it can be done by medicated milk, it can be done by takra, you know, various forms of mediums are available to do the Shirodhara. And of course Shirovasti is done with the help of medicated oil or Kurambu or Thailam. The Talam is applied with the help of powder. So depends on the condition, you can choose these methods in order to improve the mental health. Okay, basically this the Shirodhara is done with from the specific height. Okay, continuous warmth of the medicine is maintained, pressure is maintained, continuous pouring is maintained, so pressure effect is there, okay, the thermal effect is there, okay, then the environment is very calm and quiet, so the penetration is there, so through the lipid medium, so all these things will together helps to calm down the mind and helps improve the dopamine level, reduce the negativity, okay, increase the production of serotonin. All those things happens when you do this through Shirodhara, okay, basically, okay. This is what you can see, it decreases the rate of breathing, it improves the serotonin excretion, okay, so it removes the heart rate, it calms down the heart, okay, and it lowers the sympathetic tone, okay. So basically it does all these things so that person feels calm, relaxed, he feels sleep when you do this, okay. So basically this is how the mechanism of Shirodhara happens, that you can go through. My slides are always there, pressure effects is there, then fall of blood pressure happens, heart rhythm goes down, you feel very calm and quiet, penetrative effect, pressure effect, thermal effect, electrical effect, all those things are there, okay. So basically if you see, then next comes the nasya, where you put the medicated oil or ghee in your nose, okay, in order to prevent some of the, it can be for preventing the disease, it can be pacifying the disease, it can be eliminating the doshas, it can be prevention of doshas, pacifying of doshas, or eliminating the doshas from the head, neck and shoulders. So any problem arises in the head, neck and shoulders, nasya is the answer. So mental diseases, neurological diseases, diseases related to the brain, okay, brain fogginess, all depression, anxiety, everything you can treat through this nasya karma alone, okay. Basically it's also fantastic one for preventive as well as curative disease, okay. So basically this is how the nasya works, because you have the cavernous sinuses, the facial veins are there, in the nasya, it's a big topic, so you all know, like, how the this nasya works. Shringatakam Vrijit, in Ayurveda it is state, it reaches the Shringataka Marma, where from there the nutrients and everything is absorbed through the blood circulation and it is transformed to the brain, okay. So, and not only that, morbid doshas are expelled from the nose, and nasohi shiraso dwaram. Okay, if you want to enter the shiras, nasa is the dwaram. So basically you put the medicines into that, automatically you take care of the disease of head and shoulders, okay. Then next comes the prevention, improving immune system, where Rakta Mokshana plays an important role. Bloodletting, you just see how, you all know when you give the blood what happens. So bloodletting also, it entirely reset the immune system, okay, entirely, because you remove all the old cells, RBCs and everything, the formation of RBC takes place new, everything happens. You can see in the internet, or you can go through Google, or you can search in the books also, how removing the blood once in a while helps you to improve your immunity, helps you to take care of the metabolic disorders. It's fantastic treatment. In long back they have found out, so it is very, very important to do this Rakta Mokshana, or even if you don't do Rakta Mokshana, give your blood, okay. It's very, very important in prevention as well as improving the immune system, okay. So removing the vitiated blood through Jaloka Ucharna, through Prachana. Prachana is where you make small cuttings, or through needling where you make small incisions, small pricks, all those things are used, the Jaloka, the Hirudo medicinalis species, to remove the vitiated blood, that is Rakta Mokshana, okay. So basically Pitta and Rakta were involved, the Rakta Mokshana is done, okay. So, and it removes the various toxic substances from the body also, okay. Basically, the Rakta Mokshana types, okay. One is with the Shastra, one is with the Ashastra. So Shastra is Prachanam, Kuttanam and Siravidam, okay. And Ashastram is Alabu, okay. Then Gati Yantram, then you have this Jaluka Avacharanam, okay. And Shringam also, okay, where you don't make incision. Of course, Shringa you make incision, and it is Shastra as well as Anushastra you can call, okay. So basically these are the Anushastra ones. Okay, in this Gati Yantra also comes along with Alavu Jaloka and Shringam also. Okay, so basically then comes all the allied Panchakarmas where you have Abhyanga. Okay, it improves the circulation. So all over the Abhyangam Nityam Achret. They told every day must. It has become very fascinating thing. Like people go for massage and once in a while. Abhyangam Nityam Achret. They told in basically in Dinacharya. We don't do even once a week. Okay, Abhyangam is and Vyayamam, Udvartanam, Snanam, all these things are dinacharyas. So that's the reason why they told Abhyangam Nityam Acharet. People are not following it very properly, okay, which is very, very important. Do once in a while at least Abhyangam, or if possible every day. You know the importance of Abhyanga. Already they told how when you become old, the stick, our body will become like a stick where the bend or the flexibility is completely lost. So a person who applies the oil every day, where he can bend, easily. So this is what it is told. So very, very important. Okay. Then you can see various maneuvers, used in Abhyanga, aid in muscle contraction, help in alternative compression and relaxation of soft tissues, causing venous blood and lymph drainage. Okay, then action or arterial flow, it improves the flow of blood flow, the arteries, all those things. Okay, detoxification. Okay, basically this is what it does. So I told about Panchakarma detoxification. I told about the Purva Karma and Pradhana Karma. Again, once again, obesity, I spoke about it, very important. Okay, basically to prevent the obesity, Shodhana Karmas are very, very important. Not only obesity, I concentrated here only of obesity, but all the lifestyle disorders, Panchakarma is the answer. One must go for it, and all the students, those who are attending, they must be knowing how the blood sugar comes down, how people are losing weight by Snehapana and Virechana or Vasti. You all would have noticed it. Okay, then Lekana Vasti, very, very important for obesity. Okay, it is how it scraps the fat, all those things it is mentioned here. Then Udvartana, I told it is two types. One is mixed with oil, one is not mixed with oil. Okay, so it can depends on the, if Vata is involved along with Kapha, mixture of oil can be done. If only Kapha is involved, only dry powder can be given. So very, very important in all the metabolic disorders like obesity, because you see insulin resistance, polycystic ovarian syndrome, then diabetes mellitus, thyroid, all are friends. So that is the reason why in diabetes you can see Aragodadi Kashayam they have mentioned, though they mentioned in the skin, you see the diabetes skin diseases comes. Say to Aragodadi Kashayam you take, it works on obesity, it works on reducing blood sugar also, it can work on thyroid also. So when you think like that, you will understand how our medicine works, how our olden days itself, our Acharya have clearly told what is the relation between Madhumeha and Staulya. Okay, very, very important. And when you understand this thyroid problem or Varnadi Kashayam, all those kind of things are Chandra Prabhavati, you just think about it, you will have understanding of how these diseases are, how these conditions, polycystic ovarian disease, infertility, obesity, okay, and thyroid, all those things are goes hand in hand, especially in female. Okay, and even how it is Madhumega and obesity causes the erectile dysfunction or loss of libido or sexual dysfunction in males, and how it is causing skin diseases, all those kind of things you will understand once you go through this properly in our texts. Okay, you can see Udvartana helps, Abhi helps in the skin, all those things. Okay, so basically I want to conclude, okay, this about this. So basically this should have been come last. Okay, so I wrote about this one, this slide is mismatched, so I would like to conclude. So health is a very important factor in nowadays human life, because it directly affects the performance of human being in her various domains of life. Through Panchakarma we can attain a balance between these various life domains. Physical wellness is an important part of health. It may include strength, flexibility, speed, endurance. Strength can be improved by the method of Basti Karma, especially in Niroga Basti and Asthapana Basti. Then flexibility can be improved by Svedana, various Svedana therapies, and Shirodhara can be used modality enhancing attention and concentration. Rakta Mokshana is established procedure for improving the immune system of the body. So when you do all these procedures, you attain good health, you prevent lots of diseases. So with this, I'll conclude my presentation. Hope you got some idea about the Panchakarma and how it works in preventive as well as the curative aspect. If you have any questions, I am happy to answer. I thank the organizers for giving me this opportunity to present my view. Though I don't know whether I satisfied everyone by presenting this, but still I tried my level best to give you some kind of knowledge which I have little bit. Thank you one and all.
Thank you so much, sir, for your downpour of information. It was quite informative and scholarly. I request the participants, if you have any queries or doubts to be answered by our resource person.
Please raise his or her hands with any questions.
Sir, shall I ask a question, sir?
Yes, please.
Sir,
Okay.
Sir, actually, when we go for allopathic, medicines, they have so many tests with the help of so many machines. But if I have a problem, if I directly come to you, even without testing like that, how actually the process of Panchakarma could be made?
See, basically, madam, it's a very good question. It's a very good question. Sometimes, though we study Ayurveda, we know, every system has its own limitations. Every system has its own excellent thing also. So basically, I am the person, I don't know about others. I am the person who always want to use the technology. Nothing wrong in using the technology. Okay, so basically take the example of Rakta Mokshana. You want to do the bloodletting. You want to remove the blood. Nowadays, you have technology to understand what is, you can't, if you don't do the, normal blood routine, you may not know what kind of diseases persons may have, HIV, HPV, they may be using blood thinners, maybe the coagulation factors may not be there. So in those patients, if you, do Rakta Mokshana, then you will end up in having trouble only. So definitely wherever possible, take the example, a stroke patient comes. You need to know whether the stroke is due to hemorrhage, whether it is due to embolism or thrombus. Okay, because depends on this, your treatment varies. Your Ayurvedically varies. If there is, lots of blood is there, contusion is there, if you refer him immediately, they can do the craniotomy and they can save the person's motor functions and other thing rather than you give your medicines immediately. Whereas when there is a block and other thing, embolism, you can help with medicine. So these, advancement really helps to plan our treatment accordingly and to plan our treatment very well. So I would suggest everyone must use these advancements because these are all diagnostics.
Yes.
If you sit, okay, I will see only Nadi, I will see only Dashveda Pariksha. You can see, I am not saying, but now our advancement is more. When something advanced is available, nothing wrong in using them. It will make you a good clinician only. Nobody is going to ask why you are not, because rather than doing or rather than making a person suffer by not doing this, you may definitely, when you don't do that, you may end up in causing a trouble to the patient.
But do you have such facilities in your hospital itself,
Yes,
or
we have some facilities. Of course, we are trying to improve in many Ayurveda college and hospital, including CT scans and everything they are having. Okay, especially in North Indian state. Whereas here we refer people. Of course, we have all the blood related work. We need to have the central laboratory where we have to do all the blood related work, and we have our X-ray unit and other things. So the simple things. Okay, but as per the NCSM norms, they are trying to improve this, and every hospital must have all the modern laboratory diagnostic techniques. Okay, if not, we do send people outside to do. So basically, even sometimes I don't even prescribe. I say people, okay, first and go and take the scan and come to me, then it will help me to pinpoint your disease, then accordingly I will treat you. Okay, so this is very important according to me. You may have various Ayurvedic techniques, but the recent advancements are very, very helpful to pinpoint the disease, and nothing wrong in using them, and one must use them, then only you will be a best Vaidya or practitioner.
excellent, sir. Thank you for your genuine and honest reply. I'm very happy about it. And let us really take the objective of Ayurveda, swasthya rakshanam, and aturasya nivaranam, and whatever are shared by sir, we'll take home. Sadvrita is very important, and we'll follow Dinacharya, Ritucharya, and Shodhana. And sir said, if one takes up this Panchakarma,
We
the
have two more
disease will.
questions in the chat box. We have
Yes,
two more
yes,
questions in the chat box.
yes, yes.
Sujata Sharavanan is
Yes, ma'am.
asking, can you help me
Please,
to
please.
explain how Panchakarma help the special children?
Yes, sir.
Yes, in special children case, all the allied panchakarmas and matravasti, simple medicated oil enema, helps in the we always at least once a month we get autistic children, mild delayed milestone. We have recorded it, and we are presenting it in the journals also, where allopathy doesn't have much to say there. So this, especially the special need children, Ayurveda really, really, helps. And of course, it's a long process. It takes 2 years, 3 years, like 3 sitting, 4 or 5 sittings of Panchakarma. I remember one child came in last year, and now he started going to the school. Now also I admitted one child where it is not able to walk. He is not able to walk. He is not able to concentrate. He used to fall. Now he is walking and running. He has come he's come for the second time. He's recognizing. He's talking. So we can do all the matravasti, small nasyam. This pradimarsha nasyam. Okay, we can do talam, shirodhara, all those small things, mild panchakarmas. We can do it in those children, and definitely good results you can expect from that.
Sir, in how long the duration can be for each Panchakarma, from one Panchakarma to the other one, sir?
See,
for the special children. I'm Sujata Saravanan.
Yeah, it is clearly slated in our, if a person want to do the entire Panchakarma, you need 144 days. Okay, that's what the calculation is. But basically, as I told, we don't need to do all the Panchakarmas. So we need 1 or 2 Panchakarmas. So basically, like 1 month or 45 days or sometimes 21 days also enough to do 1 or 2 Panchakarmas. And of course, allied Panchakarmas always we combine with the main Shodhana procedures.
So the integrated practices like yoga and Ayurveda go hand in hand. So the I'm a yoga consultant. So if we work together for the special children, if we take for the pilot study for 1 or 2 years or 3 years, so how we can make it in a...
This is the need of the hour. Now not only I do Ayurveda in especially the paralysis or hemiplegic patients and the special need children also I'm combining physiotherapy now. Okay. I'm not only doing Ayurveda, I'm combining physiotherapy also. Okay, the results are very good. Like that, definitely in the special need of children, not only yoga and Ayurveda and all the speech therapists, all those people. So
Yes.
it should be a combination of everything.
Yes.
Will definitely will help the quality of that child, and that child can have normal life. It's a need of the hour. Definitely collaborations can be done, collaboration must be done, and
Yes.
it is going to come in future. These things going to come. It is, I see this is coming, and it should be open heartedly. We have to accept it, and we have to invite everybody to work together to improve the because every human has the rights to live beautifully, live normally. It's everybody's rights. It's a right of that child. So it's mother, father, the healthcare workers, everybody should work together to help that child.
Thank you, Shiku. Thank you.
Subhashri, you can unmute and ask a question, ma. Dr. Subhashri. And there is one more question also from Neha ji. She can also unmute and ask. Dr. Subhashri wants to know, is reversal of diabetics possible through Ayurvedic Panchakarma methods?
Not possible. If it is it's a lifestyle disease. Okay, until and then, if diabetes along with obesity, if you help them to reverse the obesity, yes, in some cases I have seen the reverse of diabetes. Okay, but once again, in the due course of time, once again the increase of weight happens, then slowly the blood sugar goes increase. So it's a constant process. Okay, if not, it is not reversible. It is preventable. Nowadays I get people, you see, this is happening really, really. Even the diabetologists are not knowing why it is happening. They are putting 2-3 drugs together, still the blood sugar is not coming. They are increasing the dose of insulin, still the blood sugar is not coming. So such people I am getting. So such people, when we do this panchakarma along with some medications, we could able to get rid of the insulin, and we could able to make them survive with one allopathic medicine along with our medicines, and the resistance is coming down, and they could able to live normally with our medicines, with simple allopathic medicines, where previously they used to take 2-3 combinations of drugs along with insulin, still the blood sugar used to be high. So such scenario I started seeing that in these cases panchakarmas are really, really helping. And all the diabetic side effects like skin issues, okay, mental depression, or diabetic ulcer, all those kind of things are easily preventable through our medicines and panchakarma.
Neha ji has a question. Can you unmute, ma'am, and ask the question? And we also have one more from Dr. Sureka Das.
Neha ji wants to know, is there a course of Panchakarma anywhere near New Delhi?
There are people, you can personally ask me, I can find out and tell you. Whereas if you want to do, it's better to come to south and do, it will be more beneficial. You can give, madam, you can give my number. This participant can talk to me, I can help
Yes,
her.
yes.
Shall we?
One more question is there. Dr. Sureka Das. What are the 9 Palaniyad and 9? Yes, yes.
In the context of Ayurveda.
Yes, in Charaka Samhita, in the context of Ayurveda.
What is that? I didn't hear.
19 Palini
19 Palinis and 19 Mulinis. She's written.
Mulinis. Palinis and Mulinis.
See, those things, in Charaka Samhita, they have written like, what are the benefit things of, Panchakarma to aid, like, the Moolas, Vrikshas, Phalas, and, all those things you can go through. I don't know much about it.
Thank you so much, sir, for your reverberating replies and very fair and genuine. Thank you so much. And let's all take home the message. Health is a state of complete physical, mental, and social well-being from Sir's lecture today. And shall we go to the next session? Over to
Thank you.
Dr. Rama
Thank you
Devi.
very much. Okay.
Thank you so much, sir.
Yeah. Have a nice day, everyone.
Thank you so much, sir.
Dr. Lata
Yes.
Satish Madam has already joined. Dr. Lata Satish Madam, wholehearted welcome to
Dr.
you.
Lata Satish ma'am, namaste. Dr. Rama Devi is there? Dr. Rama Devi? Are you there? Has she joined us?
Whoever need to be unmuted, please request to Mishra ji.
Please unmute Dr. Rama Devi and make her co-host, sir. She says
Yes.
she's not able
Yeah.
to unmute.
Yes, ma'am. I got it now. I got it. Thank you, ma'am.
Yes. Okay, please.
I hope I'm audible now.
Yes, ma.
Yes,
ma.
you are. Yes,
okay.
you are.
Okay. Okay. Is Dr. Lata Madam is there? She has joined.
She has
Lata Madam.
already joined Dr. Rama Devi. Yes.
Okay.
Madam, are you there, ma'am? Could you?
Yes, I am here. Thank you.
Thank you.
Namaste,
Yes,
ma'am.
Rama.
Namaskara.
Namaste, ma'am. It is on behalf of Global Sanskrit Forum on this auspicious occasion of the Foundation Day. We deem it our pleasure to welcome you, ma'am. Dr. Lata Satish, madam, has a degree in psychology, and she's a senior yoga therapist. She has spent over 2 decades as a UGC research scientist from the University of Madras. She holds a PhD degree in psychology, and she has been long time mentored under the yoga master, Dr. TKV Desikachar, and under the BKS Iyengar, she got a mentorship. She holds a MA, MPhil, PhD in psychology. Madam has long time been the head of the research of Krishnamacharya Yoga Mandiram, very famously called as KYM Chennai, and served as a managing trustee from 2009 to 2014. Currently now Madam is the chairperson of Board of Trustees of Center for Indian Knowledge System. It is called as CIKS, and a governing committee member for the Moraji Desai National Institute of Yoga Ministry of Ayush. Madam has 4 decades of teaching experience, and she has authored more than 50 research articles and publications. To mention a few, yoga interventions for the rehabilitation of seizure condition and epilepsy, efficacy of yoga therapy in managing headaches, stress and high blood pressure, yoga and diabetes management, and Madam has professional affiliations like she is a member of Indian Yoga Association, and also research scientist, former research scientist of Department of Psychology, University of Madras. We deem it our pleasure to welcome you, Madam. Thanks for joining us. Very eager to listen to you. Over to you, ma'am.
Shri Guru Bhyo Namaha. I really appreciate this forum and also render my thanks to you for giving an opportunity to share the knowledge on yoga, mainly yoga as a lifestyle for mental hygiene. Within this brief time, I would like to share a few ideas about how yogic lifestyle can have an impact on maintaining the mental health and hygiene. Now, I would like to share the slides so that you can follow me comfortably. So that is why I am trying to take some time on this. Okay, 1 second, please. I know I am clearly not aware of the type of the audience that I am facing. Keeping in mind young scholars, students, and probably some researchers, some therapists from various fields who have joined this forum, I am taking into consideration an heterogeneous sample, and I'm also taking into consideration the time duration that is available to me. And within that, I would like to present some of the thoughts on this particular issue. Now, when I talk about mental hygiene, it doesn't mean mental health. It is a practice that enhances the well-being of the person, psychological well-being. Just like we brush the teeth so that we maintain the dental health, likewise, we maintain the mental health also through certain practices. So in that connection, I would like to present some of the ideas for which you can be tuning in your work so that you can accumulate knowledge and try to harness yoga as a lifestyle. Now we have three trends, triad of toxins in the mind. One is anxiety, another is depression, another is stress, which is very, very common. It is called as mental toxic triad. Like the physical toxic triad is high blood pressure, blood sugar, and lipid. All the three is considered as toxic triad of lifestyle diseases. Likewise, in the mental health realm, that is in the psychological realm, if you have an inability to regulate your anxiety, if you have an inability to regulate your mood, and you don't know how to face the day-to-day stressors, you are vulnerable for some form of distress. I'm not saying that you are becoming a psychological pathology in you. It is not that. A small sense of uneasiness can trigger into a cascading effect. Over a period of time, you may become a chronic worrier, or you may become a chronic mood disturbed person. So in that context only, I am alerting this. Now, what is happening here in India is the demographic asset, whom we call demographic asset for us is the youth. Those in the age group of 14 years to 19 years are teenagers, adolescents, and those who are in the age group of 19 onwards to 30, up to 30 years are considered as youth. This group of people who are nearly 40% of our population are this group, asset for the country. And this asset is the most vulnerable for this toxic triad because there is an increasing trend of anxiety and depression among the youth. So therefore, therefore, it becomes a very important search for all of us to find out a solution to prevent this problem among the growing population, especially youth. So there is a need. The need is to address the primary level, prevention level itself, so that you don't get into a big problem. So in that connection, yoga as a samskara, as a conditioning, becomes a buffer. I'm not talking about yoga as a therapy. Please take that away from your mind. For that, there are so many other people who can teach you that. Okay? Samskara. Samskara is a conditioning, acculturation process, a way of refining your body, breath, and mind so that you are ready to face the life situations or challenges. Why I call this as a buffer is buffer means something that helps you to get into a shield, a sort of kavacham for you is we did a study on some 1,000 students who are in the age group of 18 to 30 years. Among these students, we found that those who are practicing yoga, those who had a regular regimen of yoga practices, they had a very good, what we call as psychological resources for their own well-being. Number one, their level of health risk behaviors were very, very less, hardly anything. Whereas the group which were not practicing yoga had all sorts of risky behaviors. They were more likely to drive rashly, get engaged with unwanted hassles and problems with peer group, and they would be always abusing either cigarette smoking or some abuse of substances. Whereas the yoga group had a very good protective mechanism for them to not get distracted by unwanted health behaviors. This was a major finding that which we investigated a decade back. So we know that yoga is a samskara which is like a kavacham for the kavacham means protection for the people. Now, why it is a kavacham? Because yoga is holistic. It is something that is not just body oriented, not just somatic oriented. It is not just merely a physical activity. Every physical aspect of yoga has an underlying mental process. And every mental aspect of yoga, whether it is dhyana, focus, or visualization, has a physical impact. Because in yoga, mind and body are never treated separately. They are treated together as an integrated principle. So when you pull Lata, along with Lata, the body also comes. When you pull my body, along with it, my mind also comes. So that is the reason why yoga is taken as a mind-body holistic approach to the well-being of the person, and it is a cultural practice. This practice has gone through, yoga practices has gone through tremendous change across the world. It has become very, very, very differentiated. It is no longer in its original form. It has become simplified, modified, codified in a different way across the world. I am not into that, but hold on to the image of yoga, practices of yoga as it was originally conceived, and that is there in the traditional realm of the culture. Those practices are holistic. When we teach yoga, we don't just teach posture, we also teach something for the soul of the body, that is the person's inner core of them, their lifestyle, their habits, various other habits. So therefore, it is a holistic thing. This is what I want to make in my presentation is when you look into this thing. Please don't take it as a disjointed, different techniques of yoga. Take it as a holistic, integrated processes that helps the person in a very, very broader sense. Okay. Now, when I talk about yoga as a samskara, there are two components. A samskara can be an achara. Achara is a ritual, a process of practice where actions are predominant. Actions are predominant. Asana and pranayama, they come into that achara. So how I get up, how I carry on day-to-day activities, and how I treat my body, how I use my body, use or misuse my body, this becomes the acharam. So this is what you would have heard in the Ayurvedic classes, Ayurvedic sessions also, because they also talk about charyas, charati, how you move around. So we give a lot of importance in the practices of samskara of your body, how you use your body. So that ensures a healthy body, which can be checked in terms of flexibility, suppleness, and also in terms of endurance, stamina, all the things the previous speakers spoke. All the physiological process are very well regulated, will be under your control. Number one, I am talking about the youth, especially for youth, because in disease condition, the type of postures will be very different. Commitment. Because this becomes a habitual pattern, you commit to a lifestyle which will be a daily discipline for the person. True. And this ensures a sense of control and direction for your own body. Unless you have a regulation of your body and breath, you cannot take control of anything. That way, this samskara was a part and parcel of all education in ancient India. Same way it continued for long duration. Sometime in between, the culture changed and many people diverted to many other physical culture. We also had other forms of physical culture like Mallakam, Kalaripayattu and all those things. But they also had yoga as an incorporated in that samskara. So this has a lot of significance for the development and growth of an individual, especially during the primary growth period like children, pre-adolescent, adolescent, as well as youth. So this samskara was part and parcel of education system, and incorporating that is very essential because in modern times, most of the disease management, especially depression, mood disorders, behavioral activation, that is physical activation, is taken as an important daily routine and activity to bring the person away from depression. So what the modern science says, to make somebody active is essential to make them get out of the depression medicine, was already built as a samskara in the knowledge system. So therefore, remember, when you think of yoga achara or yoga sadhana or yoga samskara is completely the physical activation, because that ensures mind also comes out of its own preoccupation, rumination, sadness, mood, etc., etc., etc. Okay. Now let us take the second component of yoga, which is the mind. Yoga samskara is a vichara samskara. Vichara is deep reflection. If you just do the posture, it is not enough. You have to reflect on the way the posture is done, what it happens to your breath or to your mind, what is your mental status, and your own reflective analysis of your issues, how you study, how you remember, how you carry yourself. All these type of contemplative, introspective aspects are also part of yoga samskara. So that part of yoga has a immense potential in preventing certain unwanted emotional dysregulation, unwanted lifestyle disturbances like coping with some abuse or something like that. So therefore, it is very, very important that the person takes a good control of their own mental processes through a reflective inquiry. So these two are the most important pathways through which yoga becomes an important psychological tool to help a person in preventing before they get into any type of distress. Number 2. So any achara vichara can really be a buffer for unwanted vasanas or impulses coming and interfering in the later life. That is what is the most powerful aspect of this particular type of education. Now I go to the real component of what is yogic lifestyle. Many people would have given a beautiful definition. You can always access all of them through internet. But however, I would like to say what is yogic lifestyle. What is it that I really have to incorporate as my lifestyle? Now, there are a lot of practices, assortment and variety of disciplines of various practices are there. All these practices starts from something gross at the body level, and it moves down towards something very subtle called as deep mind level, very deep mind level. Now, let us take Kaya Samskara. You should know how to work with the body. Take help of a teacher, and people have to take care of certain experienced people and work out a regimen of asana practice, which gives you a very good input on how your body responds, reacts, and capable of doing something, not capable of doing something. Those aspects you will really understand. Then you can regulate it without any problem in the later time. So Kaya Sanskara is an ability to take the body in a state of Stiram and Sukham, a sense of maximum potential, optimum efficiency of your body. So that is possible. Usually when youth are encountered with their own stresses, their body will be very intact. Absolutely no problem, because biologically young people are least vulnerable for problem. But still, the body may deteriorate. Early signs of blood pressure, early signs of blood sugar, early signs of skin irritation, all may come up. The PCOD condition. Therefore, having a good regimen of practices of movement with the breath regulation is Kaya Samskara. Then there is a real Prana Samskara, ability to understand how to breathe, what is my breathing comfort level, how to breathe, what ratio I have. Class. Kaya Samskara, likewise, you have to understand your own capability in terms of your own breath and your own energy level. What is my energy? What makes me depleted? What makes me very, very complete and capable of taking more tasks? That is what is Prana Samskara, Prana Sanchayam. Sanchayam means accumulations. not depleting it with unwanted things. When you get distracted with something, that means your prana is depleted or it is going away from somewhere. Trying to bring it back and holding it on what you want to do is prana sanchayam. Of course, there are a lot of other techniques like bhavanas, mudras, nyasam. These are the simplest techniques to enhance the awareness and regulation of your mind. Even the smallest practice like strataka for 5 minutes, 7 minutes, gazing, or doing a mantra repetition for few times, 12 times or 24 times can regulate mood, can shift the mood, can help you to take control of your task very well. That is why it is called mano samskara, something to condition your mind. Usually it doesn't happen. You are all very good. But what happens is at the time of a distraction, you can't go and search for something. But if you have practiced it, that will become handy during that time. Just the way you do know varum and kapam, like where before something hits, you take preventive measure, no? Like that, you have to do a practice which keeps you regularly intact so that you can on the spot do some small type of practice so that you can shift your distress or attention in from something unwanted. Now there are a lot of contemplative practices, different types of dhyana or meditation. They are called as antaranga sadhana. Antaranga means something inward oriented. Antaranga. So these are called chitta samskara. Samskara means conditioning your mind not to allow unwanted, insignificant, non-functional or irrelevant things to come and sit there and bother you. This happens to many people who are in the process of development and they get distracted. Now, right now, with the neat paper leakage, at least thousands and thousands of children are completely distraught because they have put lot of effort for 2 to 3 years and today all their exam goes down the drain and they have to again prepare. This is real waste of time and they feel dejected and cheated. No, that is where the chitta has to stay stable and not get scared. They should not feel that fear. For that, they should practice something. And of course, parents become support system. All those things I don't deny. But still, there should be that ability to take the challenge. We had one problem with COVID, we had another problem with the Middle East war, and then we had another problem with something else. Now, this internal problem within the system. So these are all contingencies of life. Ability to face the contingencies of life is what comes with the type of integrity that you develop within you, which is not dependent on outside, but it is dependent on something within you. Yoga has a lifestyle which disciplines the way you interact with the world. That too discipline is called as yama and niyama. The way I engage with others and the way I engage with the material world around me, the way I use the world and the world uses me, both are transactional. Both are transactional. That part comes with the practice and belief in yama and niyama principle. The details of which you can always gather anywhere, but I'm not going into the detail. All these, I'm just taken a few example of this. All these contribute favorably, positively to build the resource at the body, breath, mind level, and it is completely distinct from other form of physical exercise. You may go to swimming, you may go to sports, you may do a lot of dancing, you may do a lot of gym exercise. All those things are out of interest and hobbies, you may do it. But this is something very different from all those things. You can do that also. I'm not saying should not do, but you can do other physical activity also, but have a yoga samskara in as a part of it, so that it becomes something unique dimension. Just the way a honey, no? Honey is added into the medical preparation, herbal preparations in some Ayurvedic medicine, in some Ayurvedic, because honey is yoga vahi. It retains its own quality, but it enhances the quality of the herb. So, like that, this yoga is a yoga vahi. It will enhance the quality of whatever task you are doing, but at the same time, it retains your integrity and your well being and your cost. Whatever exertion you are making, it will be very well intact, so that you don't feel tired after the whatever work you do. That is why it is one of the best ingredient in the everyday life of a person. Well, 1 or 2 days, if you don't do it, doesn't matter. I am not such a strict this thing. So what it does is, it refines your body breath. It also reframes your body according to the each day's expectations. And it also restores if you have depleted your energy. Let us say you have studied for 5 to 6 hours for exam and you feel exhausted. Just do some simple seated breathing and some simple movement. It restores your energy and you feel a sense of well-being, and you're ready for the next task, or you're ready for next assignment. It is something like that. So that is what is the lifestyle of yoga means. Now I come to the last part of my presentation. What it does is samatvam. It regulates and stabilizes your day-to-day mood, day-to-day well-being. Immediately after the practice, most of the people experience a sense of subjective well-being. But if you can hold it throughout the day, that means your practice is very good. If you hold it for a longer duration, excellent, you are very good. Concentration and ability to focus. Even simple breathing of 5 to 6 rounds enhances your focus. Suppose you are able to do it with mantra and other things, what happens? No, your task orientation increases. That is called as kaushalam. Yoga karmasu kaushalam. Whatever task you do, whether you are cooking, reading, preparing for exam, or doing some marathons, fine, you will be able to do efficiently without cost. And sattva efficiency enhancement, what it does is, your state will be your state of mind, which is considered to be healthy mind, is sattva mind. Your state of mind moves from rajas, tamas to a little bit of sattva. Not complete sattva, that happens to the sages. A little bit of sattva. When you are in a state of sattva, your ability to grasp, ability to hold material will be very good. Prajna, your awareness will be so good. That is the efficiency required in all the tasks. Like, for example, there are 10 people sitting and discussing. One person is very calm and listening to everybody. That person is in a state of sattva, because the efficiency to integrate the material that comes to your mind and hold on and take a decision appropriately, keeping the good of everybody, is called as cognitive efficiency. Ability to solve problem in a very fruitful manner. This happens in all leadership roles. So that's why I'm telling, it's very important when you are developing as a young person, as a leader, you should have this capacity to get into that state of sattva. Vivekam follows from that is the vivekam, ability to discern what I want, what I don't want, what I eat, what I don't eat, what is good for me, what is not good for me, what is good for everybody, what is not good for everybody. Like that, there are so many aspects where you have to take a proper choice. Yoga is appropriate choice making. You become more and more focused and able to get it. Impulsivity will come down. It is the impulsivity which causes a lot of wrong choices. So when you're deciding your career, if you don't make a proper choice, you will end up with a lot of 1 year waste, 2 year waste, God only knows. Lastly, lastly, a sense of happiness and well-being. I'm not assuring a big thing. Momentary happiness and well-being. If you're able to achieve that, and if you are in that state, no, you don't have to bother about everything. Life is damn easy. This is the wisdom. This is the wisdom of ancient India. And you have to hold on to that in your hand as your own torch. That's what I want to say. Thank you. Any questions?
It was very interesting session, ma'am. So you have clearly mentioned what is yoga and how you have to go about it. So nowadays, often we call the very stressful life tension. So this has become a very common word for even a 2 year toddler also started using. I'm very tensed, stressed. So you have mentioned how what is samatvam and how you have to balance your chitta. So thank you so much, ma'am.
Thanks.
Any questions? Any questions?
Most of this will be available online and all of you know this, but just try to remember few points which will help you in the long run.
So as usual, very nice and great session, ma'am. Thank you very much. It was very nice listening to you after so many years. Thank you, ma'am.
Thank you,
I
ma'am.
think
Thank you.
Niyati ma'am want to
Yes.
ask some questions. Niyati
Yes.
Chitalia ma'am, please
Yes,
welcome
ma'am.
ma'am.
Yes, ma'am. Thank you for a very enlightening lecture, very to the point and so nicely asked. I would like to ask, are there people who are so troubled coming to you for counseling? And if like they come to Ayurvedic physicians also, can we use some of these techniques and help them?
Definitely, madam. Please, you have the best orientation, and especially in NIMHANS, they're doing a lot of work on this, using yoga integration for handling psychological issues like depression and other thing. NIMHANS they are using. I feel the Ayurvedic physicians should integrate yoga in their practice because you have it in your syllabus. I think most of you studied. Simple breathing techniques, simple movements will really help them to calm, regulate their breath, and you will also be able to notice the difference in their pulse and other things like their Vata Pitta Kapha, and accordingly you can give practices. And Ayurvedic doctors also have investigated the effect of pranayama and other things, and you
Yes.
are not I mean theoretically we are cousins, Ayurveda and yoga people, so it is very easy for you to understand, and it is good for you to integrate it, and start with something simple techniques so that they give a feedback. Whatever feedback they give, accordingly you can scale up your practices and other thing for them. Especially mind calming techniques you can definitely use, like breathing regulation, extending the exhale, things like that.
Yes. So relating this one question, I will ask you in Abhinivesha, the klesha that Abhinivesha that we say, I'm having certain people who are maybe their cousin has passed away or somebody, and then there is so much fear in the mind about, and then because of that, this patient is showing symptoms of high blood pressure or what, but everything is normal when we are doing the tests, everything is normal. So this Abhinivesha, how to remove that fear of that?
Yeah, I don't want to go into the technicology of the Abhinivesha, then I will go to you. You know, it is the insecurity feeling and the
Yes.
fear. It's the fear
Hmm.
is the underlying cause. Fear is characterized by a sense of overwhelmed feeling. There is an
Hmm.
overwhelmed feeling on which they do not have control, number one.
Yes.
And it is underlying the fear is the attachment to the life. Okay.
Correct.
Am I,
Yes.
so there is
Understood.
an attitude attachment to the life. We can't tell, don't get attached to life. This is normal in the world. That cannot be said because that will put
Difficult.
that puts that it is unethical.
Yes.
I may have a philosophical view, but that view may not be there in the person. So that means
Yeah.
you have to give an assurance on the continuity of something. What is the continuity in this world? That has to be given. Number
Hmm.
one. Second one is to reduce the fear. You have to bring in the techniques of movements to reduce the blockage of fear. So that is what
Okay.
in our therapy, no, prana movement is the one which facilitates the fear diffusion, the diffusion of the fear. So it can
Yes.
be movement of the body, movement of the thought from one to another thought, that will help in diffusing the fear and
Hmm.
simultaneously stabilizing what is continuity. For me, personally, I will use what is continuous in life. For example, day
Hmm.
continues. Things won't stop just because somebody is not there.
Yes.
The sun. So that is why we have eternal symbols in the world. Surya, Chandra, Samudra, river, etc., etc., etc. So find out what is the Shraddha of the person. According to the Shraddha of the person, incorporate something to bring that continuity so that the
Hmm.
person holds on that. And most
Yes.
of our teacher in KYM, they use the belief in God and other thing that they will
Yes.
use.
Yes. Yes.
But some people will get angry with God also. So we have to
Huh.
allow for that. So that's why you
Yes.
have to make a inquiry. You have to make
Yes.
a inquiry and find out the Shraddha of the person, and that Shraddha has to be. So continuity of the progeny is considered to be one of the strongest belief system. Continuity of work that they are doing, like
Yes.
hard work.
Mechanically continue doing. Yes. Correct.
Exactly.
Understood. Yes.
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 So you give that purpose, then the fear slowly comes.
Yes. Ma'am, very, very enlightening session, and thank you very much. Thank you.
Very informative, ma'am. Thank you so much.
Thank you, dear. All enjoy your life.
Thank you so much, ma'am.
I'm leaving. Bye. Bye.
Namaste, ma'am. Thank you.
I'm so happy this did not go wrong or anything. So good Guru graces there. Thank you very much. Shubhamastu.
Thank you. Thank you, ma'am.
Thank
Thank
you
you
so
so
much.
much for your.
Yeah. I'll take leave, ma.
Yes.
Thank you very much, ma'am. Thank you.